Glaucoma is one of the leading causes of blindness in persons older than 60. It can occur at any age, but it is much more common in older adults. Today on Sound Health, our focus is on how to beat invisible glaucoma. I'm Olasunbo Modupe. Welcome to the show.
The National Center for Disease Control (NCDC) says there is no new confirmed case of COVID-19 in Nigeria. Apart from the index case, a total of 48 people have been screened in Lagos, Ogun, Edo, Abuja, Rivers, Enugu, Kano, and Yobe states, out of which 47 tested negative and have been declared free of the virus. The second patient quarantined after testing positive to COVID-19 also tested negative. The Minister of Health, Osage Ehanire, says the viral load is insignificant and will be discharged soon. Meanwhile, the index case at the Infectious Disease Hospital, Yaba, Lagos, is stable. Its additional sample was retested and came out with reduction in viral load. The NCDC has also confirmed that the laboratory result of the patient in Enugu suspected to be COVID-19 is negative. The World Health Organization has confirmed the disease as a pandemic. So far, over 150,000 cases have been reported worldwide, 26 from African countries, more than 73,000 recoveries, alongside a rising death count of over 5,000. The public are advised to practice the following precautionary measures: report suspected cases, as well as call emergency help lines.
It's still Sound Health on Lagos Television. Today on the show, as the world celebrates Glaucoma Week, Dr. Gloria Okoehian, an optometrist, will share her expertise on how to manage the eye condition. Welcome to the show, Doctor.
Thank you for having me. It's a pleasure to be here.
Okay, Dr. Okoehian, what causes glaucoma?
Glaucoma doesn't have a particular cause precisely, but there are risk factors associated with it. Let me first start by defining what glaucoma is so we have an idea. Glaucoma is a group of eye disorders that can damage the optic nerve, and it leads to loss of vision or even blindness. Reason being that the optic nerve is the cable that connects the eye to the brain. So when these disorders damage the nerve cells, it invariably leads to loss of vision and blindness. And the difficult part, or the challenging part, is that it doesn't come with any sign or symptom at the early stage. But we have risk factors that can predispose us to developing glaucoma.
How do I know I have glaucoma?
At the early stage, you really will not get any sign or symptom. So you more or less will not know you have glaucoma. But the easy way out is for you to go for an eye examination, because it is through a comprehensive eye examination that the doctor will check your eyes, check your eye pressure, check the back of your eyes. And there are so many other tests involved that we do that will help us come to a diagnosis of glaucoma. So you as a person, you really will not get to know. The few symptoms that you will find, which will come at the later stage, are blurred vision. You begin to experience blurred vision. You can see flashes of light. Then sometimes some people complain of halos around bulb. That's like rainbow colors around bulb. Those are things that can happen in some cases. Then in the other case of acute, as in sudden, we call it acute close angle glaucoma. That particular one is associated with severe pains, sometimes nausea and vomiting, but that is rare. The other one is chronic, so it's a slow process, and you see the vision gradually deteriorating with time. That's why we call it the silent thief of sight, because it doesn't give sign. Most
Silent
thief of sight, the silent thief of sight, because it does not give any sign or symptom. And in most cases, damage to the vision from glaucoma is irreversible.
Okay, Dr. Okoehian, what are some of the risk factors of glaucoma?
Yeah, there are many risk factors of glaucoma. Remember I said earlier that there is no known cause, but we know the risk factors that predisposes us to developing glaucoma. And number one, top on the list, is raised intraocular eye pressure. When the pressure of the eye is higher than normal, it can cause glaucoma. Family history is another risk factor. If it happens that any member of the family, parents, grandparents have it, it's actually a flag, you know. It raises a flag for developing it. Age is a factor. Black race is also a factor. Then we have some medical conditions like diabetes, hypertension. These things can predispose us to developing it. Trauma is also another risk factor. By trauma, we mean accident to the eye, you know, when the eye is hit either by blow or any other accident, which is not well managed. That can predispose one to developing glaucoma. Then prolonged use of some medications, especially steroid. Prolonged use of steroid. When you use steroid for a long period of time, one of the side effects is that it causes the eye pressure to go higher than normal, and that invariably is a factor. Then we also have some other eye conditions like those who are highly short-sighted. They are also at risk. So these are the basic risk factors that can predispose one to developing glaucoma.
That brings me to my next question. Is it hereditary, and are there types?
Yes, you know, I said one of the risk factors is family history. So that puts it in line with being hereditary. However, not all members of the family must have it. But if one member of the family has it, that is an indication that every other person should begin to check. Because you never can tell who will eventually develop glaucoma or who will not. Now, there are different types of glaucoma, but I want to limit our discussion to just the two simple ones.
Two simple or common ones?
Two common ones. We have, no, not really common. The common one is chronic open-angle glaucoma. The open-angle glaucoma is the common one. And we said it's chronic because it's a slow process, it's a long process. Then the other one is closed-angle glaucoma. One is open angle, one is closed angle. The open angle is slow and it takes a longer period of time. The closed angle is acute, sudden onset. So, and that is more devastating most of the time when there is no immediate attention. However, the open angle, which is a long process too, also has its own challenge because it's slow and there is no sign. People just let themselves be. And by the time they come to the clinic or go to the hospital for